the number one issue that you have with text messages is TCPA. TCPA is a federal law that talks about the consent requirements related to text messaging. TCPA was originally designed to address phone calls and really to address robocalls back in the days where, we all had landlines and, Congress wanted to make sure that people weren't getting robocalls during dinner, and we weren't getting, all of these annoying phone calls from automated machines calling us during dinner. Well, TCPA has sort of grown up over time, and it has been used and interpreted moving forward to today to include text messaging when you are using automatic text messaging capabilities. In other words, if you are text messaging human to human, in other words, you as a provider, your nurse, your front desk person is actually holding a phone and texting a patient, TCPA would not apply. However, if your electronic health record system sends an automated text message that is an appointment reminder, or you have a prescription refill system that sends an automated text message about prescription refills, or your billing system sends an automated text message about a bill coming due, or your patient engagement system sends an automated text message about a patient survey after a patient visits your office. Those would all arguably be covered by these auto dialer requirements under the TCPA. And you need prior express consent to do that. In other words, you must get written consent from the person that you are texting using one of these auto dialer methods before you send that text message. There are also requirements here, this is a very quick summary that I've pulled from the TCPA compliance website, that is the government website, that talks very briefly about the TCPA requirements. And there is much more here. Obviously, there are some exceptions for emergency communications in certain very limited circumstances. We generally do not recommend relying on those except in actual emergencies. Some of our clients have heard that there are, in fact, healthcare exceptions. That is true. But again, they are very hard to fit into, and the plaintiff's attorneys are very aggressive about litigation involving those types of messages. So we do not suggest that you generally rely on those exceptions. So in other words, this is really standard practice to make sure that you get express prior consent, and that means written consent, so written agreement that includes a clear and conspicuous disclosure to the patient that indicates that they will be getting these text messages and that they're not required to sign that agreement. And then there are other requirements as well. And as you can recall, I'm sure you've all seen these, you have to be able to enable an opt-out with a stop. So if you get a text message back that says stop, you have to opt out that particular patient of any future text messages immediately. There are these additional requirements that you must implement associated with these TCPA requirements. And again, this is a highly litigated area. If you continue to send text messages without consent, written consent, if you continue to send text messages once someone has requested that you stop those, it is very likely that you will see a demand letter from a plaintiff's attorney because this is a very litigated area of the law. So this is, a barrier to entry for text messaging. If you are going to do text messaging of any type using automated methods, that is, any of your electronic health records are sending automated messages, your billing records, your patient engagement, if you're sending automated messages of any type, text messages, SMS text messages, then you need to get prior express written consent from your patient, and you need to enable the other TCPA requirements like opt out.